Major changes are coming to Medicaid coverage in Nebraska and across the country over the next few years. It's because of the One Big Beautiful Bill Act.
Well, state lawmakers met for a hearing today to clear up some of the murkiness and consider the impacts to rural hospitals and patients. KETV Newswatch 7 Capitol Bureau Chief John Grunwald reports.
Major cuts to Medicaid. The details still murky just around the corner for Nebraska.
I also wanted to make sure the most current details on funding changes in the program were available.
Lawmakers zeroing in on the changes from D.C. and what that will mean for administrators here, work requirements, and more frequent eligibility determinations.
There will certainly be an operational cost to implement the program, but it's a bit too early to identify the extent of that cost. Any potential reduction in federal funding would be due to reduced enrollment, so it would scale down proportional to the need.
Reduced enrollment, meaning thousands without the coverage Medicaid brings.
We'll go back to a system where we have 90,000 Nebraskans who don't have coverage is a scary thing.
A tense exchange between Senator Michaela Cavanaugh and the state's Medicaid administrator.
I can tell you that I think everybody's sort of learning as we go on this too.
You're being invasive because you don't want to say the quiet part out loud, which is we are doing everything we can to increase the Medicaid excess fund. You are harming people who need medical care for property tax relief.
Nebraska is a largely rural state, and some on the Appropriations Committee pointed to concerns over healthcare deserts. A new program will see tens of millions of dollars flow to rural hospitals all across the country and in Nebraska. But some testifiers expressed doubts that would cover the costs of the cuts to Medicaid.
These Medicaid cuts will continue to strain the hospital's resources, lead hospitals to reduce or eliminate services in their communities, and force patients to travel greater distance for care when they need it most.
A cause some lawmakers may take up in the coming session. Reporting for KETV Newswatch 7, I'm John Grunwald.